care interview questions and answers right here. And this is these questions I'm about to start discussing is from people who went for care interviews. So they came back to say that this was the question they could remember they were asked during the interview section. So yeah, I will start with letting us understand that care interview can be divided into three. You understand? Care interview can be divided into three. I'm just trying to break it down so you understand different segment of care interviews. All right, care interview questions and answers. Yeah. So let's get started. Where is this? Where is this? Yeah. So let's get started. Now, care interviews can be divided into three segments, like I said. They have the technical questions, they have the personality questions, and they have experimental questions. So why am I saying this? The reason I'm saying this is because this person that went for this interview, she said three people were sitting down in the office with three different papers. This person will ask her, this person will ask her, this person will ask her. Yeah, so she got the job. Good luck. Congratulations to her. Thank God it was a good news. But later she said she became friends with one of those people that interviewed her. So she was asking her, why would there be three to interview her just to become a healthcare assistant? So she told her that three of them have got three different questions. All right. And I said, yes. When you go for interview, mostly you have more than one person sitting down interviewing you. Okay, they are recording different things, not the same. So after that, they're gonna put it together to see if you qualified for the position you have applied for. And most times, those questions are being divided into three segments. They are testing your technical skills, your personality, and your experimental, skills. So the technical questions, they just want to see if you have the basic knowledge required for the job. They want to see if you got the basic knowledge as somebody coming to work as a healthcare assistant in the hospital or in a care home. They want to check if you have got the basic knowledge that is required for you to do that job. They want to see, if maybe if you have witnessed some common conditions or similar, a lot of things happening in a care sector. If you have basic knowledge, maybe somebody that have worked in the hospital as a cleaner, there are some basic knowledge you will have as a cleaner working in the hospital. At least you would see where nurses are doing one thing or the other. You would see there are some things you would witness, okay, and that thing will give you that knowledge they are seeking to see if you have. All right. Now, personality questions. Personality question is to determine the kind of person you are. They would ask you some scenario based questions, like they will paint some scenario based questions to you to see how you would react to that. Okay, they will, this is where they will ask you some behavioral questions. A client or patient do not want you to come into their room. What would you do? All those type of things. They want to see how you would react, your personality as a person, how you would react. All right. Now, the last segment is experimental question. This is where they will check your past experience, and this is where I come in always to say to you that you must not be a professional healthcare assistant somewhere else to work as a care assistant in the UK. No, you do not need that professional qualifications to work as a healthcare assistant in the UK. You don't even need it. They just want to see your past experience, what you have done. They want to see the transferable skills you have. What do I mean by transferable skill? If you have in any way cared for somebody, You guys used to see me ask questions when somebody come to say, oh, if I have not got experience working in care, how do I answer this question? And the first question I will ask the person, have you ever cared for somebody before? And they will say yes. If you have ever cared for somebody before, then halfway you have been prepared, because you are still coming to care for somebody. Are you getting me? So they are checking. The experimental question is more like checking your past experience, what you have been doing before, how prepared you are, how that thing you have been doing before have prepared you somehow, knowingly or unknowingly, to do care job in the UK. So you do not need any special qualification to become a healthcare assistant. No, you don't need any special qualification to get in. All they need you is to show the transferable skills you've got. For example, you've been working in a restaurant anywhere you are, and you find yourself in the UK. After checking, you feel like, oh, let me go into care, let me change career, let me go into care and see. Now you go for interview, you are scared, you've not worked in the care sector before. What would you answer? Listen, somebody who is working in a restaurant, you've got a lot of transferable skills working in the restaurant. Now, what transferable skills am I talking about? As somebody working in a restaurant, you have a lot of people you deal with. You have people with anger issues. You have people who will come, they have problem at home, they will come to release everything on you. You have people who are so hungry that they cannot even calm down to take menu to give you what they want. You have a lot of them, so you deal with them. Wow, you have a way, no matter how they present it, no matter how they lash out, you still calm down to say to them, oh, we are so, you still apologize for what you do not do. Customers are always right. Yeah, you still apologize for things you did not do. You don't even know what caused them problem, but you still have to apologize. We face the same in care sector. So you are coming to say that whenever I'm faced with somebody who have got a behavioral issues, challenging situation like that, behavioral challenging situation, I keep my calm, I listen to them, I apologize, and this is what I do. This is what you are doing in the restaurant. The same thing you would do when you come to care, because some resident or patient families, because their family member is sick, they would lash out, they would be angry. Some of the medical procedure, they would not want to welcome it, even though it is in their best interest. But you still have to apologize. You still have to understand. You still have to carry on with your duties, because you've got a duty of care to deliver. So you are a stylist, maybe a hairstylist. How do you speak to your customers to remain calm so you can deliver your services? So whatever thing you have been doing before, there must be something you have learned. There must be a skill you have learned in that field that you can transfer to care. So this experimental question is where everything lies. So do not think, oh, because I've not worked in care before, I cannot do it. No, you can do it. Most especially if you have cared for somebody in the past. Your sister, your friend, your mom, your dad, your grandparents. Have you cared for them in any way before? If yes, then do not come up here to say, I've not worked in the hospital before, I've not worked in the care home before, I'm very scared, I don't know if I can do the job. Good morning, Mr. Chooks. I don't know if I can do the job. You can. Why? Because that person you cared for have prepared you halfway to come and care for somebody. Now, when you have passed that interview, and they recruit you, you will start with what we call induction. You will be inducted. They will show you around. You cannot use any equipment except if you have been trained. You cannot handle anything except if you have been trained and certified that, oh, you can now do this. All right? So do not be scared to say, oh, I've not worked in care sector before. I don't know what I will find there. It is still the same. Most people that come from Africa, okay, by nature, by default, we are carers, because it is our culture to care for our parents, our granny, our younger siblings. It is in our culture. If you remember, there was a time I gave us a scenario how to answer a question where they ask to tell them how when you have went above and beyond to do something extraordinary. What did I say? That I was the big sister to my younger siblings, and one day my mommy left us to go to the market. Before she could come back, I have showered all my younger siblings, make food for us. I have washed all the plates, mopped the house and everything. And when my mommy came back, she was like, she never believed I could do it. She was so happy. That was me going out of my way to do something extraordinary, because nobody expected that I would do that. They were still thinking I'm still a small baby. I cannot even manage. So why did I use that example? Because this is a transferable skill. I did not wait for my mom to come back to continue from where she stopped. No. So if I could use my initiative to understand that my mommy have gone to market, I can help my mom by doing this. If I get into care, I wouldn't wait for anybody to tell me, oh, this resident is incontinent. I should help. Even though they are not assigned to me, I should help. So that is where the experimental questions come in. Before I move into these questions they brought here, the person that went for it, like I used to tell people, when you go for interview and pass, do not just come to say, oh, I passed, oh, thank God, I'm coming to do it. No, the only thanksgiving you will come to give me is to bring those questions they ask you. So if it's not something in general, like something that we are so common with, we can talk about it and people will add it to their own knowledge. That is the best, or the highest thing you can do for me. I don't need your money or anything. I don't need it. Just come back to tell me, this is what they ask. Please teach people. And I will go and read about it with my knowledge and skill. Then I will come and teach people so that others will learn. I saw a comment yesterday. Somebody saying she passed her interview. It was everything in my video they asked her. They also gave her sponsorships. People on my Facebook will read that comment yesterday. And I said to her, listen, she said, when I start working and they start paying me, I will ask for your account number. I say it countless times. Do not ask for my account. I don't need your money for anything. What I need from you is to understand my video. Go for that interview. Conquer fear. Have confidence. Pass that job interview. Get that job for yourself and start earning your money. It's enough for me. So one question they asked her was, what do you know about safeguarding policy? On a normal, we are so familiar with what is safeguarding. Yeah, we are so common with what is safeguarding. We all know that. That is how most times they ask that question. What do you know? What is safeguarding? I passed my interview. Thank you so much. Congratulations. What is safeguarding? That is how they ask it. But what made it different now is that this lady, they ask her, what do you know about safeguarding policies? So when they ask you what you know about safeguarding policies, please do not start shivering. Oh, I did not read about safeguarding policy. I only know what safeguarding is all about. No. So safeguarding policies are policies put in place to protect the vulnerable people from, to protect their health and well-being. It's just a policy put in place to protect these vulnerable people we care for, to protect their well-being, their health and well-being, to protect them from anything that will cause them harm, abuse, to protect them from all neglect. That is what the policy is all about. This is automatically also the definition of safeguarding. So when they ask you, what do you know about safeguarding policy? Just start it again. That safeguarding policy is a policy that is put in place. That is a policy put in place to protect the vulnerable people, from anything that will cause them harm, abuse, neglect, to protect their health and well-being in short form. So if they ask you what is safeguarding policy, do not say, I read about safeguarding, I don't know the policy. It is the same. So tell them that safeguarding policy is a policy put in place, okay, to protect vulnerable people's health and well-being, to save them from anything that will cause them harm, anything that will cause neglect, anything that will cause abuse. That is what safeguarding policy is all about. But please do not stop at that definition. This is how the question was. What do you know about safeguarding policy? Do not stop at that definition, that like defining safeguarding policy. No. Go ahead to tell them that as a healthcare assistant, it is your duty of care to protect the resident from anything that will cause them harm. It is your duty of care to notice when a resident or a patient is not in a safe place. It is your duty to recognize, it is your duty to report, it is your duty to document. Let them understand that you know your duty with respect to safeguarding. That is what I'm trying to explain. Like, after telling them that safeguarding policy is a policy put in place to protect the health and well-being of the vulnerable people, go ahead to tell them that as a healthcare assistant, it is your duty of care to recognize when a resident or patient environment is not safe. It is your duty of care to recognize when somebody is at risk of abuse. It is your duty of care to recognize when he said my heart is out of shape. Do you know I did not even notice? Thank you. I didn't comb my hair. I would have just leave my hair. That's why I'm putting on there. Some people are crazy. I'm telling you. Thank you so much. She said my heart is not in good place. I should put it where. Is it okay now? Thank you so much for that wonderful observation. A lot of people did not observe it because they are so interested in what I'm saying. We need to pass our interview. Okay, so tell them that safeguarding policy is just, thank you so much. It's just a policy put in place to protect the vulnerable people. Please make use of that word, vulnerable people. Yeah? Because why are we making use of vulnerable people? It is because they are not able to care for themselves. They are not able to protect themselves. They are not able to do a lot of things for themselves. So they depend on you as a healthcare assistant to protect them, to care for them. All right? So safeguarding policy is a policy they put in place to do what? To protect this. So if you do anything against the policy, you have committed a crime and you will answer for it. You get my point now? So that is what it is. But do not stop at telling them just what safeguarding policy is all about. Also, let them understand that you know your job. You know your duty of care. When I say duty of care are your responsibilities. They are your job, what you have to do for the people you are looking after. So duty of care shouldn't be big, big word to you. When I say duty of care, that is an umbrella. It all means your responsibilities, your duties towards people you look after. What are your responsibilities? It includes uh, protecting them, providing food for them, providing good and safe environment for them, making sure they are well. If you have been trained to give them medication, making sure that you give them their medication at the right time. So all these things are your duties. Engaging them in activity, and all these things are our duties towards the vulnerable people we look after. So you just have to let them know that as a healthcare assistant, it is your duty to protect this resident or this patient. I repeat again, when I say resident, I am referring to people we care for in the care home. When I say patient, it is still the people we care for in the hospital. Okay? Just like school children, when you talk about primary school, we don't call them students yet. Yeah? But in the university or secondary school, we call them students. So we are still referring to people in school. So when I say resident or patient, I'm still talking about the same thing, just that in the care home. And as in the care home, we call them resident. Even people at home, domiciliary care workers, I think they call them service users. They are still referring to those people receiving that care from us, those people we render our services to. I hope you, if you come across this question, which of the NVQ should I do for care assistant role? NVQ level 3. So if you encounter that question anywhere, do not shiver. Do not say, oh, I didn't read about safeguarding policy. No. So I will repeat the answer one more time, then I'll go to question number 2. So what do you know about safeguarding policies? Safeguarding policies are policies put in place to protect the vulnerable ones' health and well-being. It is a policy put in place to protect the health and well-being of the vulnerable one you look after. It is a policy put in place to protect the vulnerable ones you look after from all forms of abuse, harm, and neglect, and whatever, whichever way you want to put it. Just know that it is a policy put in place to do what? To protect the vulnerable ones. Why am I using vulnerable? Because they cannot care for themselves. They are at our, you know, they depend on us to protect them. They depend on us to help them, to support them to do things because they cannot do things for themselves. Anybody can be vulnerable at any point in time. So what at any point in time you find yourself in a position that you need help, you are vulnerable. I'm just stressing that word, vulnerable, so you can understand. If you find yourself at any position that you are not able to help yourself, you need another person to help you. At that point, you are vulnerable. Okay? So, I repeat, do not stop at just defining the policy. Go forward to tell them that as a healthcare assistant, that your duty of care is to make sure that these people are protected. Your duty of care is to make sure that whenever you see any signs of abuse, you recognize it. How do you recognize such signs of abuse? When you see bruises on their bodies, you see, that bruises, unexplained one. Nobody could explain how they sustain that bruises. It could be on their back, it could be anywhere. When you see that, that person might be at risk of abuse. Maybe the person needs to be repositioned every 2 or 3 hours, but the carers are not doing it. They just left the person at a position, and this have caused them to have pressure ulcer and all those bruises. You see that, what do? You have to report it. You have to document it so that they can start treatment immediately. I saw a comment here that said, talk about confidentiality. If you would spare some time for us, I will note it down so I don't forget it. Confidentiality. If you can spend a little time with us so we can finish. It's just 3 questions that this lady came and they gave me here. They asked her, she went for healthcare assistant interview in the hospital, HCA in the hospital. If you can spare some time, let's finish, then we'll talk about confidentiality. Yeah? Yes, service users or clients. That's it. Now, we're done with number 1. The second question they asked her was, imagine a patient has heart attack. What would you do? Imagine a patient has heart attack. What would you do? In the care home, if something like that happens, what we do is to call for medical emergency ASAP. We call the ambulance immediately without wasting time. The ambulance will come and take over and take the person to the hospital. Now, you in the hospital, if something like that happens, what do? You call for medical emergency. You call for help. Okay? I remember that time in the hospital where I worked at Onisha. I could remember we were taught then that if a patient have got heart attack, and they are conscious, they can still recognize their environment, we should give them aspirin or so. Yeah, we give them aspirin, but if they are unconscious, we should start CPR. So to be on a safer side, as a healthcare assistant in this country, I don't know if you have access to give medication to a patient. I am not sure. Remember, we've got professional boundaries. You must not overstep your boundary. So, as a healthcare assistant, you witness that a patient is suffering from heart attack, call medical emergency, call for help immediately. Call for help. I know back in my country, we do a lot of things. Auxiliary nurses, we do a lot of things that we shouldn't do. Here in this country, do not tell them that you will give aspirin. No, don't say that. Even there is one they call nitroglycerin also. I don't want to go into, I'm not a doctor, but I could remember because I worked in the hospital before coming here. So please, if you witness that a patient, Miriam say press the emergency bell. Thank you, Miriam. So if you witness that a patient have got heart attack in the hospital, in the care home, anyway, what you have to do is to do what? Call medical emergency, call for help. Now, when you call for help, it is left for them to instruct you on what to do. Whether you will start CPR if they are unconscious, if their care plan says resuscitate them, if you have to, if you have been trained. Otherwise, what? Call for help. Call for medical help, emergency help immediately. That is what to do. You are just a healthcare assistant. You are not a nurse, you are not a doctor. Even the nurses in the hospital, they wait for the doctor to give instruction before they will carry it out. So you are not licensed to give medication to anybody. Just call for help. Alert the nurses and the doctors that something is going on here. They will come and take over from you. So the last question they asked her, she said, imagine a patient does not want you to come into their room. What would you do? Imagine, if you guys are following through, you will understand that number one question is testing about this technical question. Like I said, if you join me from the beginning, I started by explaining how they divide care interview questions. You will notice that the first question they asked her was all about technical question, testing about the general knowledge of what she knows about being a healthcare assistant. Imagine a patient has heart attack. They are testing the I don't know where to categorize this one. If this person have heart attack, well, it is the experience. If you have experience working in any of these places and something like that happens, what would you do? Now, this last question, imagine a patient does not want you to come into their room, what would you do? To me, they are checking experimental, the experimental question. They want to see how you would react when somebody do not want you to come into their room. What would you do? Okay, so how to answer that question is this. If I want to attend to a patient or a resident and they refuse me coming to their room, I will allow them some time. That is what we do. We allow them some time because they have right to refuse. They have right to refuse you from coming into their room. They have the right to say to you, I don't want to have shower. They have right to say to you, I don't want you into my room. So in that case, you allow them some time. Give them some time because they have right to refuse. Go back and before you leave, inform them that you are going to come back in 20 minutes, in 30, tell them, okay, I'll be back in 20 minutes. Or, okay, I'll be back in 30 minutes. Take your time, it's fine. I'm not coming in now. Take your time. I will come back. The reason you are giving them time, the reason you are allowing them time is to, sometimes they might be agitated at that point. Sometimes they are not even ready to come off the bed. They are not even ready to see you. So when you give them that time, in their head, they've known that, oh, somebody have come before, I didn't want them. Now, it's possible they will come back again. So they will start preparing their mind. Do not also stop at that. You have to inform the person in charge. What skills, qualities, life experience do you have that you feel would help you succeed in this role? How do you answer this question? Okay, hang on here. I will add it. That will be number 5. After confidentiality, we'll talk about skills. This is what we do here. Okay, so you have to report to the senior in charge that, oh, I have gone to attend to this patient in room 1. They are not, he or she is refusing me from coming in. I've informed him I will come back in 30 minutes time. Okay, and you go and continue with other patient or other resident. In 30 minutes time, you have to go back again, knock on the door to let them know, oh, are you happy to do this now? Most times they will say yes. Sometimes they will say no. No problem if they say no, but you just have to prompt them. Oh, you have to do this, you have to do this, you have to do that. If they say no, leave my room, it is fine. Document it. Yeah, remember to document the first one. Inform the senior in charge, go and do something else. Tell them, okay, I will come back in 20, go back again. Only these 3 times at different interval. It could be morning, afternoon, evening. Only do it at different interval. If they are not allowing you, they are aggressive, you would never force them. Alpha, you would, I'm good. You would never force them for anything. You only have to do what? Document it, report it. I will not marry you. Document it, report it, and do what? Document it, report it, and come back again. That's all you have to do. They have the right to refuse. They have right to say no. They have that right. So understand that they have right to refuse. So if you understand that, you will never force, because if you force them, you are not doing your job. That is a crime. You don't force them. You don't force them. So that is all. Number 1 question they ask her, what do you know about safeguarding policy? I've done justice to that question. That was the number 1 question they ask her. Number 2, imagine a patient has a heart attack. What do you do? Okay. Number 3, imagine a patient does not want you to come into their room. What do you do? So I've done justice to these 3 questions. And another question that come here from Facebook said, I should talk about confidentiality. People on TikTok, do you have any question to ask? Put it down, I will note it here. But I have 2 questions here from Facebook coming to say, I should talk about confidentiality. Another person said I should talk about skills. Now, talking about confidentiality, the question, yeah, I don't want to mention it. So thank you, Alex, for responding to that. So confidentiality, this is how they can ask you the question. They could say to you, what do you understand about confidentiality? Or they could paint a scenario-based questions for you to say, you've got a patient and the do we call it neighbor? We don't have neighbor. Somebody next to the person have got a visitor as well, and they approached you to say, oh, they are looking at this person, what is wrong with them, what are they passing through, what would you do? They are testing that confidential. They want to see how you react. You must not disclose what that person is passing through. You must not tell them the medical condition of the person. If you do, you have breached confidentiality. So it could come in any form. So if they ask you direct, what do you understand by confidentiality? You just have to tell them that confidentiality is all about protecting your patient's information from getting into unauthorized hand. The person that asked this question, are you still here? So that is what confidentiality is all about. If I want to stress it further, I would love to tell you that confidentiality also goes down to discussing about your patient or your resident health record, their email address, their phone number, their name, telling a story that could be traced back to that person. Like if I come here to say to you guys, I witnessed somebody who was Somebody who the family member they never visited, they don't care, they don't want to know about the person. This woman have got 3 houses in Westminster, this woman have got 3 houses in Aberdeen, this woman have got 10 houses in Glasgow, this woman is this woman. And somebody who is working in the same place with me could trace that we've got a resident who the family member do not visit, who have got houses in Westminster, they've got houses in Aberdeen, they've got houses in Glasgow. Of course, they would know, oh, I am talking about Mrs. Geraldine. If they pick up that video to present to my management to say, oh, Juliana is talking about Mrs. Geraldine, and the management look at it to see, we have a person, a resident or patient in this place. Her name is Mrs. Geraldine. She's got 3 houses in Westminster. She's got houses here and there. And the family member never visited. And this is what the home is struggling to see how they will bring them in. Now you are going to talk about it. They will sack you immediately. You are going home. That is if they don't sue you. So telling a story that will link back to somebody, that is breach of confidentiality. You must not. You must not. So, protecting your patient or your resident information, when we talk about information, everything concerning that person, protecting it and making sure it does not get into unauthorized person. When I mean unauthorized person, the only person that must have access to that information is the doctor for the health record, the approved family member. You guys know that even most family members are not allowed into somebody's care, some of them. So the approved person, if they approve, oh, it is the daughter that should, only the daughter have that right to ask you question and you answer. A random person cannot just come and introduce themselves or ask, oh, I am the niece. What is going on? What is the doctor saying? How long does they, you do know. You just have to tell them, oh, I'm sorry, please, can you speak to my management about this? So, your team member, the people you are working with, the team members include your management, because all of us are working as a team, your colleague on the unit, the doctor in charge, the social worker or the advocate, whoever that is in charge, involved in that care. Only people involved in that person's care should have access to that information. The cleaner there shouldn't have it. The security person there shouldn't have it. They have no business with that. So that is all about confidentiality. How will you maintain it? Everything I'm saying is how you maintain it, by making sure you don't share those information out. Protecting that, when you are protecting that information, you are maintaining it. When you are not sharing it out, you are maintaining it. When you are sharing it only to the authorized person, you are maintaining it. If do you understand it now? That word, how do you maintain somebody's how do you maintain confidential? You maintain confidentiality by not sharing those information out. You maintain confidentiality by protecting that person's information, making sure it does not get to unauthorized person. You maintain confidentiality by making sure that you only share that information only to people who should have it, people involved in the care. Like I said, for example, your team members, which include the management, the doctor, the advocate, the social workers, and that is it. Ifeinwa, do you understand my answers? If you have any question, you can ask. The other question I got here is to talk about skill. How did you put that question? What skills and qualities or life experiences would you have, do you have, that you feel will help you to succeed in this role? Okay. Before I go into answering that question, I'd like you to understand that as a healthcare assistant, you are expected to have empathy. Oh, you were asking the interview. Okay, but Have I cleared you now? You are expected to have empathy. You are expected to have good time management, good ICT skill or IT skill. When I mean IT skill, not for you to be a guru, like do this, just being able the way you use your phone, because we use device at work. So IT skill is knowing how to type, that is IT skill. Okay, I don't want, it's not about being advanced. Like if they give you system in a computer to document what you have done, are you able to do so? But if you have also got more experience like us, who studied computer in school, a kind of, we did computer biology, so we are familiar with some computer terms and all that. We are able to do some maneuver animations, Excel and all those. You can go deeper. Clinical basic skills. Though these skills include, being able to know how to monitor a patient or a resident vital signs. What vital signs am I talking about? The blood pressure, the temperature, the oxygen saturation, the respiratory rate, the heart rate. If you're able to, we have a kit for that. If you have been trained and you have that skill, it is required. We have time management is a good skill. We have team working is a good skill. We have what is it called? A lot of them. We have record keeping is a good skill. We have patience is a good skill. We have um, I think I have here I listed some of these skills. So let me see. I can call as many as possible for you. Okay, when I talk about skills, good communication is a good skill. Documentation, like I said, record keeping is a good skill. Time management, honesty, accountability, being teachable, being flexible, all these things are skill. Personal care skill, good, is a good skill. Manual handling, thank you, because I cannot remember all of them now. Manual handling skills, all these things are skills that is needed in care as a healthcare assistant. So when you talk about those skills, we also have transferable skills about I think all these ones I've covered it. So when they ask you what skills have you got uh, as a healthcare assistant, tell them that you've got good time management skills, that you know how to manage your time, you know how to prioritize your task, you know what to do at every point in time so you don't get choked up. Tell them that you have good manner handling skill. That is, if you have been trained and you know what you are saying. If you have not been trained on manual handling, like you are not working as a carer yet, please do not tell them that you have manual handling skills. You know what is manual handling? It's just all about moving something from one place to another. So you might say, does it mean you cannot, you know how to move something? No, you cannot just move something like that. There is a way we move things. That's how we position to move things. Okay, if we want to dress a resident up, there is a way we position to dress them up. So if you have that skill, tell them that you have manual handling skill. Personal care skill, it all include how to give them shower or bath or bed wash, how to dress them up, take them to the bathroom, give them wash, bring all those skills. If you know have that skill, tell them you have good personal skill. Hoisting includes is involving also included in manual handling. Tell them that you are teachable. Being teachable is a great skill, is a great quality, that somebody is teachable, like somebody who is not Mrs. or Mr. Know It All. Such people, it is difficult to work with them. If you are teachable, you can easily learn from your cleaner, you can easily learn from the resident or patient, even. You can easily learn from your colleague. You can easily learn. Okay, somebody that is teachable is very easy to work with. All right, someone, unlike someone that is rigid. If you are rigid, somehow you will be rude. Tell them that you've got patience is a good virtue, is a good quality. Someone that is patient, because care job requires a lot of faith. If you are not patient, you will finish them. You will commit all sorts. Because what? They will push you to the wall to do that. But if you got patient, you can imagine you are serving a resident food and he's telling you F off. He's telling you you are this, he's telling you you are that. This is somebody you've not done anything to them. You're just coming to help them, but they are cursing you. They are using F word on you. Yeah? So you remain calm. You can only remain calm if you got patient and allow them say everything they want to say. You still apologize on top. I still have to render that service. Tell them that um you've got good communication skill. Communication skill is just the way I'm communicating with you. When you have a good communication skill, it will enable you to know how to manage your colleagues and your residents. Speak to them in a very clear and straightforward manner, in a way that you say something, somebody will not turn it to say, oh, maybe this is what she meant, trying to understand what you meant about something. No, speaking to them in a way they will understand. Knowing, when we talk about communication, remember, you cannot it's not about talking. Your body movement is a communication. Okay, so telling them that you have good communication skill includes that you know when to move your body, how to look at them so they will not feel like you're threatening them. Somebody said to me one day, why are you rolling your eyes? She did something and I rolled my eyes. Why are you rolling your eyes? You're scaring me. So you shouldn't do that. That is to them. You roll your eyes, you are scaring them. So that is communication. You communicated to them that this thing you are doing, I cannot take it. If you move an inch, it is finished for you. So team management, working as a team, is a good skill. In fact, it's one of it, because this job you cannot do it alone. We need to work as a team. I've talked about basic clinical skill, I've talked about IT skill, I've talked about personal care skill, I've talked about manual handling. Yeah, I've talked about accountability, telling them that you take account for whatever thing you've done. You don't try to hang it on someone else. Whatever thing that comes out, you take account, you're accountable for it, you learn from it, and you improve on it. Tell them that you are honest, you know however, whichever, whatever that goes wrong, you come out to say it. That is where duty of candor comes to play. You come out to say it the way it is. I have done this, I've made this mistake, you learn from it. So that is it. I think I've done justice to that two questions. Any other question you can ask people on TikTok? I'm sorry. I think you should tell the person the right way to do it, since you two are trained. Nina, are you responding to somebody? Precious Asante, that isn't a skill. What are you saying is not a skill? If you see a colleague of yours hoisting a resident and you notice he or she is not doing it well, what do you do? If you have been trained on how to do it, and of course you have been trained for you to notice they are not doing it well, what do? You help. You intervene immediately because the resident is at risk, and show them how to do it. That is what to do. You don't just go and report them that, oh, they are not doing it. No, you have to intervene, help, and show them how to do it. Now you can suggest to the management or the senior that, I noticed this person do not know how to do this. I've shown them how to do it. Maybe they need some training. That is recommendation. You're not reporting. Okay? So that is what to do. Sometimes they ask, what skills have you brought to the table if they hire you? Wow. What skill am I bringing to the table if you hire me? I am bringing good personal skill. I understand what hygiene is all about. I am bringing good communication skill. This communication skill will enable me to know how to communicate to my resident. For them to understand, they need to have their shower. Because most times, personal skill is difficult. If you do not have good communication skill, you see how they are going hand in hand. If you do not have good communication skill, you are most likely not to complete that task. So you know how to speak to them, and they will understand and be able to give you a chance to attend to them. That is good personal skill. So you know what to do, you know you things to put in place, so there will be no case of fall or anything. You are bringing good communication skill. You know how to speak to your colleagues, and things will be fine. If there is problem, or you are bringing good problem solving skills. You are not the type that is always pinpointing problem. No, you are always at the end to solve that problem. You are bringing good IT skill. You have in fact, if you are exceptional in IT, tell them that you are good with Excel. If they need you to help them in anything, calculations, or you are good with that. You are good with documentation. Tell them you are bringing good documentation skill. That you understand as a carer, as a healthcare assistant, if you do not document it, if you do not record it, it never happens. So you take documentation so serious. You record what you offer to a resident, what they have accepted, and what they have refused. You are bringing good documentation skill. If you notice any signs of abuse or neglect, that you document it and you report it to the right person. So the right thing have to be done. Tell them that you are bringing good basic clinical skills, that you know how to check your resident vital sign, the patient's vital sign. You don't need to be told. You know at intervals when to check it, and you know when to report in case you see any abnormalities. You are able to check the resident temperature, check their blood pressure, check their oxygen, you know, check their respiratory rate, their heart. You have that skill, so you are bringing it to them. Tell them you are bringing teamwork. Teamwork, that you work as a good team. You know when to help. You know when to, what are you saying? So this that's asking you the same thing. You just have to put it in a way, in a more convincing way. Like I said before, interview questions are always the same, but could be presented in different formats. Now, whichever format they present it to, answer it like that. Follow that format and answer. This question you ask, somebody went for interview, they asked her the same question, and I made a separate video about it. When they ask you, what are you bringing to our team? These are the things I'm bringing to the team. So, Elvis, is that okay? So you just have to, sound more convincing. Just like this person, they ask her, what do you know about safeguarding policy? You finish telling them that it is a policy put in place to protect the vulnerable people's wealth and well-being. You go forward to tell them that as a healthcare assistant, this is your sound being convincing is very, very important. You know, convincing, not just answering it like somebody who have crammed it, but answering it as somebody who know what they are saying, who knows what they are doing, who have got experience in one way or the other. Uh, what will personal care skill, manner handling skill. Okay, paying attention to details. Thank you so much. That thing is a very good skill. Paying attention to details is a very good skill. In fact, there was experience I had at work some time ago, paying attention to details. And my manager commended my team for that. If we had not paid that attention, ha, it might land us into trouble. So paying attention to details is just like last week, my son was admitted in the hospital. What happened? He came back from school. He was, he's a very vibrant boy. He doesn't stay, he's hyperactive. But this boy was crying, want me to put him on my back. He was unusual. It continued it continued happening up until around 9:10. I had to call ambulance. I was not saying maybe he will be fine. No, I had to call ambulance. I was paying at because I have known my son very well. So for him to go that low, something is wrong. Even though he's not running temperature, nothing. Something might be wrong. And we got to the hospital, something was wrong. He was bleeding in the stomach and vomiting blood. So paying attention to details is very, very important. You can only achieve that if you are the type that knows your resident very well. There was this training my company put me through to do. The title of the training is Knowing Your Resident Well. So if you are very familiar with your resident and they start showing some signs of, they can walk before, but you notice in the morning they find it difficult to stand up, that is a concern. You have to record it, you have to document it, you have to report it that, I noticed this morning that it was difficult for this resident to stand up. Something could be the problem. Maybe something is going on. So when you document it, and maybe by afternoon they get worse, if they ask, who attended to this person in the morning, did you notice anything? You said, yes, I've already documented it. You exonerate yourself. Okay, so paying attention to detail, not even exonerating you, but for them to take quick action before it gets bad. So paying attention to details is a very good skill you can bring to the team. Yeah. Okay, I stopped there. Let me start going back again. Did I miss anything? Please, I'm curious. Do you work in hospital or care home? Why should you be curious about where I'm working? Queen, why do you want to know the particular place I'm working? I want to know. Tell me first, then I will answer you. Even though I say it all the time. Communication pain are good. Please, I have NHS interview in business support assistant. I don't know what that means, but to help you prepare, when you have job interview, go through the job descriptions and see what the job is all about. Your questions will come from there. What about seeing someone trying to, when you see someone trying to harm themselves, what do? You try to stop them, also protecting yourself while doing so. And you have to call for help. Maybe they need restraining, they might need to be restrained. If you have not been trained on how to do that, you shouldn't do that. What do? You call for help. Some residents are at risk of self-harm. What we do is that we take off anything that they can use to cause themselves harm or people around them. We take it out. They cannot find it. But if for any reason they were able to break through somewhere else and get it, what do? We call for help. We call the police. It depends on the setting. If it's in a supported living home, we call the police immediately, because I have not been trained on how to restrain somebody, so I am not able to restrain him or her. Trying to do so is putting myself in danger. What do? Call 999. When you call 999, they will ask you, do you want to speak to police, ambulance, or you choose police and inform them that this person is about to do this. Explain the condition to them. In less than 10 minutes, police will be there and take charge. Then after that, you have to document what has happened. Of course, you need to call your office and also document what has happened. Annie, I hope I've answered your question. It's better to stop typing that because TikTok is hiding that word you are using. Can you talk about safeguarding policy again? Safeguarding policy again, I didn't get that. Safeguarding policy is just a policy put in place to protect the vulnerable ones, to protect their health and well-being. It is a policy put in place to safeguard them, to protect them, to make sure that their environment is safe, to make sure that they are protected from all forms of abuse, from all forms of neglect, from all forms of harm. They are protected from all sorts of abuse, neglect, and harm. It is a policy put in place to make sure that they are staying in a comfortable and safe environment. It's a policy put in place to make sure that their health and well-being is being protected. Everything I'm saying is the same thing. Choose the one that is simple for you. Yes? Infection control. Infection control is all about procedures you put in place to stop or prevent the spread of infection from one place to other. How do we control infection, or how do we enforce it? First of all, we make sure that we are using the correct PPE, that is personal protective equipment. We make sure that we use the correct one, and after using it, we make sure that we dispose it in the right bin, in the right place. There was a time supervision was conducted. Hey, people on TikTok, I cannot take this. I can't continue doing puzzle for us when I have over 50 people watching. You are not tapping, you are not sending gifts, you are not doing anything to keep the live active. I am surprised. People are typing under the comments. So what does TikTok want? What do they want people to do? Why are they asking me to keep putting that thing in the box, playing that puzzle to tell them that this live section is still ongoing? What do they want? So, for those working in the kitchen sector, in the kitchen, you make sure you don't put. Let me not go there. I'm not a chef. Sorry, we have professional boundary. I will start from our home. Infection control in your house. You make, the mop you use to mop your toilet. You don't use it to mop your kitchen, right? That is you controlling infection. Mm-hmm. Now, when you buy your fish, you bought meat, you bought pizza, you bought burger, you couldn't finish it, you want to put it back in the fridge. Do you place uncooked meat over your pizza, or over the vegetable, or over the fruit you bought that you want to eat? You don't do that, right? That is you controlling infection. That's procedures you are putting in place, measures. So what would you do? You will put the fish, the meat under, then put other ones up. Yeah. Your ice cream and all that. Now, when you attend to a resident in the healthcare sector, you do not use the same glove to go to another patient. Yes, do you do that? No, we don't do that. And what are we trying to prevent or control? Infection. Because if I use a glove for patient A, the same glove I am going to use it for patient B, there could be possibility that patient A have got an infection, and if I use it on patient B, I will have to transfer it. So to stop that, to prevent that, after attending to patient A, I will take it off and put it in the correct bin, put another one to go to resident B or patient B. So this is what infection control is all about. There are measures we put in place to stop or prevent the spread of infection. Did I answer that correct? Precious, did you understand now? If you need help, ask me. Okay, why do you choose to work with us, and how do we have goodness, I just answered that question. The last part of your question, how do you handle such clients? Like I said before, clients who are at risk of self-harm, let me use that word. It's better than using that SUICI. Don't use it, because you know what it means. So residents who are at risk of self-harm, what do? We make sure we don't keep anything in their, you know in their environment, in their room, wherever they have access to. We make sure we do not keep anything they can use to harm themselves. Yes. And after that, if for any reason they were able to break through somewhere and get something to do that to themselves, or maybe they are trying to destroy the window to go out from there, and we are not able to stop them, because maybe when you did what is called risk assessment, you assess the level of risk, you find out the way they are. If you go to rescue them, if you go to intervene, they might hurt you. What do? You call 999, you call the police immediately to come. In less than 10 minutes, all you have to do is to call them. Oh, I've got a client. They will ask you, where is the app? You give them the info. Now, listen, police is another person. You will not, anything confidentiality is not for the police, because they need that information to do something. The police, you cannot hide any information to say, oh, I cannot tell you the name of the patient or the client, I cannot tell you the address for confidence. No, you need to tell them, because they need to come and intervene so the person will not do something crazy. So you have to call for help. Who are you calling? You have to call the police. But first of all, our duty is to make sure the environment is safe. They've got nothing to do anything bad to themselves or to with the carers. And when they were trying to do that, we couldn't stop them. We have tried. We've tried. We couldn't. Even your life is at risk. You don't put your life at risk because you want to save who do not want to save themselves. So you have to do what? Call the police. Call your office and inform them what is going on. Call the police to come and take over. And after, please do not forget to tell them that you will document what has happened. And when documenting, you have to be precise, straight to the point. If you remember the time, write the time everything happened. I hope I've answered that. Why do you choose to work with us? Before you can answer that question, you must have gone through the company's advert to see what services they are offering, to see what they are into, and see if that is why you want to work with them. I understand that sometimes we might not even have reason. We may just want to work with them because we have heard they are giving COS. Yes, it is common, we all know. But we are not coming to tell them it is because they are giving COS. So you have to find something that is particular to the job. You have to find could it be their services? To save yourself stress, you can tell them that you want to join them because you want to progress in your career. But guy, you are coming from a care home, why don't you progress there? Now you have to find another reason, which is what I've said before. Look into their services, look into the values of that company, see why you want to find something. For example, it could be, I will use myself as an example. If I want to leave my place of work tomorrow to find a job in a different place, if that place of the new place I am going, if it's not advanced dementia setting, I am not going. Why? Because I have the dream to own a dementia facility back in my country. Because in my country, we do not have that complete awareness of what dementia is all about. And I saw some people still treat these elderly people with dementia back home as if they are wish, as if they have done a lot of bad things. Now the bad things they have done is haunting them. They bite a lot of people, unalive people, so the spirit of those people are haunting them. Now you see communities trying to bash without knowing that this person is suffering from dementia. So I have that dream that one day in my life I would go back to my home country and do what? And establish a care facility where I would take care of people living with dementia. So if I'm going to another place to work and they ask me why, I would tell I am coming to work with because I have gone on your website to see that you are offering services to people living with dementia. So I want to learn how to care for them. I want to learn more how to manage them, working with them and learning how to manage because I want to do this in the future. Okay, so this is for me. So what is your goal? Why do you want to work with them? It could also mean that maybe in the values of the trust or maybe in the values of the company, maybe they have said, when I mean values, when you read about a company on their website, you will see some of them will tell you that, like some NHS trusts will tell you that their value include inclusion, equality, um, respect. It could be anything. It could be anything. So you can start by saying that you want to join because after going through you find out that this trust or this company value equality. That means I will have equal opportunity with other colleagues. If I want to progress in this field, I will have that equal treatment, equal opportunity given to. So you have to, it's not that this answer is not automatic. I've given you samples on how to answer. So you have to check with the company you are applying to if they have called you for interview, go on their website, read about them, see what good or whatever thing your interest that aligns with their own, or whatever thing they're doing that aligns with yours, and use it to answer that question. So you must read about that company. You must. That is where your answer will come from. You want to join them because you want to help residents or patients who are vulnerable. So you go and you have to go and read it. That answer is not automatic. I am being honest. So I want to work with you because of what you are doing. That thing you are doing, I want to learn more. I want to improve on it. I want to advance on it. So that is how to answer it. Are the skills for support worker, and it is the same. Are you a support worker? You are a carer. Are you a healthcare assistant? You are a carer. Even the nurses, it is the same care that we are doing, but different job titles. Even your manager is a carer, but different job title. Because sometimes our managers come to the unit to help us. Sometimes your supervisors come to help. So yeah. How do you handle a client with anger issues? For you to handle a client with anger issues, you have to have patience at first. Yeah? Then I have to remain calm with them. Because when they have anger issues, they will start showing up some challenging behaviors, throwing things away, banging on the door, shouting, and all that. So you have to remain calm with good communication, communicate with them, offer them what they like. Maybe they've got like cup of tea, or offer to them what they like. Speak to them in a very calm way. It will help. If they are refusing, allow them some time and come back again. And also do not forget to document what has happened. Ah, what is going on, Annie and Miss B? What is going on? What is going on? If it's active, you must escalate. I don't know what Annie and Miss B is talking about. I don't know. I don't know what. Okay, it's fine. Before escalating, talk to the person to find out if they have been active or passive. If they have an active plan or path. I don't know where that discussion will start from. So I don't know. What should I do, please? I don't know what you are asking. Thank you so much. You are welcome, Richard. If you have any question, feel free to ask. Fumi, Fumilayo, customer service, please explain. I don't know what you mean by customer service. Explain. I don't know what you mean by that. Tell me what you mean. I can explain. If you want to send a request, you can send a request and come up. What about questions you don't know how to answer during interview? So how do we know what they would ask you, and how do we know you will not know that answer to that question? This is the reason I do recommend to listen to many interview questions and answers. Not just cramming the answers, but understanding the concept. And that's why if I'm teaching, you guys see the difference. If I'm teaching, I teach you as somebody who don't know anything about that. I start from scratch. I will give you examples. I will use myself. I will use our house, what we do at home. I will use what is happening in general. I like you to understand that concept. Like somebody that said I should talk about confidentiality. I am not sure that if that person go for interview or another person asks her what she knows I am not sure that lady would not answer that question. Why? Because I didn't just go straight to tell you the definition of confidentiality. I made a lot of explanations. Yes? So you can understand what that concept is talking about. If you understand what a concept is talking about, then you are good to go. You are good to go. I no longer sit down now to make interview videos. No, why? Because I have a lot of them. If you go on my YouTube, a lot of them, so many. Because sometimes when I go through them, I will be like, I can't keep repeating the same thing. So what I do now is to sit down and wait. If anybody go for interview, when they come back, they will say, oh, I passed. Most of the things I listed in your video was what they asked me. But this one was different due to how they presented it. And I will still come back again to say, look at what somebody said, though, just in case you go for interview and they ask you something. They are still asking you the same thing, oh, but they presented it in a different way. And this is how to answer it to them. So describe a challenge you faced at work and how you overcame it. Of course, we always encounter problem and challenge at work. It could be during feeding, it could be during personal care, it could be during activity, it could be a lot of things. So one of the challenges we encounter every day is during personal care. We trying to offer a resident personal care and they declined. They are refusing. We went first, second, third. They are refusing. They do not want. That is a challenge. How did we overcome it? We give them time. We gave them plenty of rooms. We kept on prompting them, encouraging them, offering them things we know that they like. As we are doing that, we are also documenting it. I tried like 3 times, I never succeeded. My colleague tried. Either they succeed or not. So it doesn't matter whether you succeed or not. But that was how you handled it. You went to offer personal care. You seek for their consent. They declined, they refused. You recorded it, you reported it. You tell them you will come back so and so time. You went back again. They refused, you recorded it, you report it. You offer them what they like. Still, they refuse. You went back for the third time, they did the same. You pleaded with your colleague to try. My colleague tried. They were also not lucky, they were not successful. You recorded it, and that is it. That is what you told. They are not asking that question to see how you did it. It is not a must though, that you will do it. If it's a must that you will do, now you are forcing them against their will. So you have to prompt. All you have to do is to prompt, encourage, speak to them calmly, be patient with them. If it does not happen in the morning, it may happen in the evening. Or you can tell them you went back the last time and you were successful. So me, sometimes I try to not end it in a negative way. You get? Mm-hmm. We try not to end it in a negative way. I went the first time, I seek for their consent, they refused. I recorded it and I reported to the senior in charge. I offered them cup of tea, coffee. I gave them time. I went back the second time, they still refused. I documented it and I gave them some time again. Then when I went back the third time, I was lucky. You can put it that way. Yeah. So what again? So that's one of the challenges. It could also mean that resident was not eating. Is a big challenge. What do? You speak to you can communicate with the resident to find out why they are not eating. You could tell them that the resident said they do not like the food. So what you did was to communicate with the chef to tell the chef that this resident have said they don't like this food and suggest if they could make what the resident have suggested. That is a challenge, not eating. What did you do? What I just said. So, a lot of challenges. You can even see somebody that would not want to take medication. That is a challenge. What do? You give them time. You cannot force them. Okay, just like the question they asked that lady, you want to go into a resident room and they refuse. What do? That is a challenge. So you still have to give them time. Record it, report it, go back. So do you understand that? What is activities? Activities are those things going on in the care home that you have to engage the residents so they will not feel bored. When they are sitting down feeling bored, that is when most times they become challenging. So activities could include maybe dancing, singing, playing ball. There's a, is it either ball or balloon, all these soft balls or balloon, they'll be throwing it. This person, this resident will throw for this person. They'll, you know, dancing, singing. That is what they do. That is all those little activities they will do to enable them, move their hands, move their legs, move their body, so they would not lose their mobility. They will not lose everything and become totally dependent on you. Mm-hmm. How do you ensure accuracy in your work? For me, I record and I follow up. I record what I should. If there is something I need to report, I report it and I follow up. Also, I make sure I undertake trainings. When you go for trainings, it will help you to be accurate in what you are doing. When you record things that you have done, it will help you to be accurate, because that is the only way you can trace what you have done before, how you did it, and if there's any room for possible changes. Yeah. Divion Goodness, thank you for bringing those questions to us. Hi Phil, if you want to send a request to come up, you are free to do so, because in the next 15 minutes I should be done with this interactive live section. I appreciate everybody that joined, those that asked their questions, those that contributed. I am so happy. Somebody was writing, person asking for me, Mana, thank you for that support, because I don't know it all. I used to say it. Sometimes I need help, because there are sometimes I will be trying to remember something, it will not come. So I appreciate that. Always come around. I have a lot of carers in the building, a lot of people who have got experience. You are welcome. A lot of people who ask these questions, so they are not asking the question because they want you to give them answer. No, they are asking the questions because it will benefit people that are listening. So they want me to answer it so people will understand, people will learn from it. So do not see people dropping questions as if, oh, they are new, they don't know what. Even so many people can ask questions because they have experience. Okay, if somebody have not been going for an interview, they will not have experience of what they ask. If somebody is not working already in that field, they might not have experience of what they ask. So do not see anybody asking questions that oh, they don't know anything. No, some of them are asking that question on your behalf. You that don't know it, you that is going for interview, you that is still scared that you don't know what your fate would be, they are asking those questions on your behalf. And if they ask me the one I don't know, I throw it open. If anybody knows the answer, they would come and help, because I don't know it all. There's nobody that. If any day I say I've learned it all, that day I will cease to be a teacher, because we learn every day. So that is it. You're welcome. Thank you, Goodness. Thank you. Gideon, why are you here? Is my this thing down? Hey. Sorry, come again, because my volume was down. I did not even know you were talking.
Okay. I said my name is Gideon and I'm currently in Kuwait.
Okay.
So I am attending this course, this caregiving course here in Kuwait. And my plan is maybe when I'm done with it, maybe I can apply with it maybe in another country. But there are so many things reaching me that in any way you want to apply it, you must have experience at least 1 year. So I don't know how possible it is.
Well, the thing is that in the UK at the moment, there is international recruitment. It's not happening. So there is no room for you to even apply for now.
Okay.
Yeah, there is no recruitment outside, abroad, let me put it like that. Outside the UK, it's not happening now. As a carer, no, it's not happening. So save yourself that stress. Yeah, go into IT, go into construction. Yeah, there is still this thing in that area. So I also want to use this up. Gideon, I think, let me give you a follow, then I think I've answered your question. So Also, some people asking me about, thank you God's grace, about NVQ level 3. If you still want to do your NVQ level 3, I recommend Oval Academy. 100%. Oval Academy. I recommend them. I don't know if Mr. Chooks is here. The manager for that Oval Academy, his name is Mr. Chooks. I don't know if he's here. Mr. Chooks, if you are here, please send me a request and address people, because I still have people listening in other platform. Okay? If you're in Scotland, I would advise you to look for the one they accept in Scotland, because we've got a situation where somebody who left England to Scotland said she went there and they said she have to do SVQ something. I don't know what she called it. So please make sure you verify. But apart from that, people in England, Wales, and Northern Ireland is okay. So you must not do this level 3 with Oval Academy. You must not. I just recommend. But make sure that it is Ofcom regulated. So for Oval Academy, it is for my certificate, it is Ofcom regulated. So for course award, Ofcom regulated. Make sure that it is Ofcom regulated. If it is not, my sister, run if it's not. Yeah, I don't know if Mr. Chooks is here. If he's here, I will appreciate if he comes and address people and let them know what they should know about NVQ level 3. Yeah, it's about 1,003. When I did mine, I paid 1,250. That was 2022. I did mine 2022. I paid 1,250 then also. So some companies take 1,500, some different amounts. So it all depends. And also one other reason I recommend Oval Academy is that this company will supply you with whatever support you need. Whatever support you need to finish your level 3. I suffered when I did mine. I did with access skill. A lot of people who know what I suffered. They just give you assignment and it is finished with you. No help, no nothing. That course is a 1-year course, but you can finish within 5 months. You can finish sooner. It depends on you. Okay, Goodness said it's SVQ3. Yes. For people in Scotland, yes. So even Chooks will tell you, if you are not in England, please do the one they are doing there. Normally, England, Wales, Northern Ireland, fine. But people in Scotland, I think Scotland is a different country. So yeah. Okay. Mr. Chooks is not here. I don't know. 1 minute. 1 minute. Let me see. He's not even online. Mr. Chooks, please come on my TikTok. I sent you request. Come and address people, please.
Okay.
Yeah, so he's coming. So why I recommend people to do this level 3, we all know that by 2028 there will be nothing like sponsorship anymore. We all know that. Yeah, there will be nothing like sponsorship anymore. So I also like to use this opportunity to tell us, especially people who are students, please use this opportunity to look for COS for yourself. If you don't have COS and you finish to get your PSW, by the time you will finish your PSW, hey, I am not sure if you can still migrate. I am not sure if you can still get, because what they do now is they will tell you that you still have a visa. I don't know if anybody have experienced that. They will say we are Scottish. I know, and I love them. You know, I visited Glasgow. I love it. They will tell you still have a visa. So you cannot switch to another visa because you still have. You can only do that when your visa is remaining 3 months, like 3 months to expire. So we are in 2025. If by the time you finish your studies and get 2 years PSW or so, by the time that extra 2 years they give you people student, they give the student, by the time you will finish, like 3 months to that, they will no longer have COS waiting for you in care. So you have to go back. Oh, a lot of things will happen to ending 2027, 28. So if you're a student, oh, now please start looking for COS. Start looking for COS. And one of the, in fact, for you to get COS now with care homes or get your NVQ level 3, learn how to drive. Yesterday I received a call. They asked me, do you have anybody that we can take, somebody who have got experience, who have COS for the person, but the person needs to drive. That was how one of my husband's friends got COS yesterday. Mr. Shooks. Mr. Shooks. There was one company in my old account. I put that company reached out to me one time to say that they need 6 people who can relocate to Kent. I don't know if people here still remember who can relocate to Kent, that they will give them 5 years COS, 3 years first, then 2 years. But they must have to relocate to Kent because that was where they got the contract, and they must be driving. It was on this my TikTok that I selected those people, sent to that company. They gave all of them. No, they did not collect any dime. Chooks, you know about this. They did not collect any dime from them. Chooks, you know about this.
Yes, I was
They
aware
did not collect any dime from them. If you have your level 3 and you have your car, it is easier. Chooks, yesterday, the same company called me to say, do you have anyone who have experience, who is driving, who have level 3 and need COA? We will employ the person and give them. Yesterday, one of my husband's friends got COS without, you know what I mean?
I know.
On a clean, like clean. I was at work yesterday when this man called me. In fact, I did not save his number on my iPhone because we talk on WhatsApp. When he said, Juliana, do you have any? I said, sorry, who am I speaking with? I said, oh, I'm sorry, I didn't save your number. Okay, give me some minutes. Let me call somebody. Let me call my husband. I think there was one of his friends he told me about. And luckily for this girl, she got her level 3. She's driving. They gave her years. They issued it yesterday. 5 years.
Can you
They
imagine?
issued it yesterday.
Yeah.
So please get these things ready. I know it's difficult. It's costly, but this is you preparing yourself. There's no point saving that money when you don't have ground yet. Okay? There's no point. Like I said, you must not do with Mr. Chooks over like it's not a must though. But make sure that wherever or whoever, whichever company you want to do it, make sure they are off-court regulated. So what happened to people in Derby will not happen to you. Mr. Chooks, please speak to people. Yeah.
All right. Yeah.
Thank you.
Yeah. Good morning, everyone. Okay. Now, with what is going on at the moment, and that's why we're doing a fast track program. Okay, so that means you instead of spending 1 year, 2 years, because that's the duration for these courses, because there are standard required amount of hours that is required to cover. Okay, before you get your certification. So what we do is this: we do fast track. We do one weekdays once every Monday to Friday training in the evening, 7 p.m. To 8 or 8:30, and it's live tutor. It's not self-taught. Okay, that's what we do differently, because some other places all you need to do is log in, then do your assignment and submit and go back and forth with the assessor. But we do it differently because of the situations and of our learners. All right. So after each training, we give assignments and we give materials, learning materials. Okay, so you now have an assessor that also will assist you and put you through. We don't leave you because we are our learners. So we are 100% with you until you get your certification. And those certificate is also regulated certificate. It's not CPD, please. Okay. You have to, and again, I do encourage people always attend classes because you are the one that's going to defend this certificate. Okay. Come on, like us, we are looking at Jen now. Okay. The way she is explaining things, that's the same way the tutors explain things. They use these are people that have 15, 18, 20 years experience in care industry. So they would tell you, teach you with their experiences, okay? And also assist you and tell you how to go about several issues that you might encounter. Then the training, if you don't have their functional skills as well, because I've seen people that have their level 3, but they don't have their functional skills master in English or whichever country you come from. Please, if you don't have that, always make sure that you also get that. Someone is asking about slow learners. Yes, the slow learners, we give us an assignment. So when we give assignments, okay, we give you learning material. So with that, you can now learn at your pace, okay? Yes, but at the same time, we try to make sure that you also get your certificate on time, all right? Then the fee is 1,300, and we operate a flexible payment plan. 500 to register. Actually, it's 100 to register, then 400 each month, because we are expecting 3-4 months you have your certificate. So when you are paying 400, that means 1,300. But if you're struggling, just call me. We have that discussion. Then you can split it accordingly. But you have to complete your certificate before your payment before you get your certificate. And again, once you register with us, we advise you to update your CVs, please. Your training in waiting. Don't wait until you get your certificate, because we can give you a letter. We've done that. People have gotten their employment with our letters, okay? Because they need to confirm that you are doing the training. After all, they are the one that put in their job advert in training, if you're in training. So if you do that, they call you for interview and ask us to provide a letter to show that you are doing the training, okay? So it's 1,003, easy payment plan. Then any questions, just ask. I'm available to give the answers, please. Someone says, I have my certificate, MVQ3 in Nigeria. If you have your certificate, Priscilla, is it Ofqual regulated certificate? If it's Ofqual regulated certificate, that's
you're good to go.
Yeah.
You're good to go. Listen, here we are not after your money. It's after the right thing.
Nah.
You must not do it, Mr. Chooks. Mr. Chooks, even people from other companies come to ask him questions. You must not. But please make sure it is Ofqual regulated.
Yeah, because some people will be like, oh, I saw someone that wrote, oh, it's expensive. I've seen that several times. What we offer you, I don't think any other organizations offer that to you. Okay, because I've seen people, like Jenny just said, they will still come to ask us to assist them in assignment. No, we don't do that. It's not possible. If you want such thing, you register with us. We are giving you, we're not doing assignment for you, but we are giving you materials, learning materials to assist you. It's like Ofqual. Let me write it for you.
Somebody who doesn't have English and math, he does it as well. Okay, Ade, send me DM if possible. Then I will forward you his number. Yeah? That is what he said. You do your maths and English is there. I think Mr. Shush said something like that.
Yes. Yeah. If you don't, you see, in this country, for those that are looking for NHS, most people have failed and they keep wondering why they failed. You have the NVQ, but you scored less than C in your WAEC. Okay.
English and maths is WAEC. Don't misunderstand it.
Exactly.
When they say English and maths, that is your WAEC. That's your A level. I mean O level. What do we call it?
Yeah. So if you score less than C, please, you better look for where we do that as well. You better update your either English or maths up and do the functional skills level 2. Okay. Yes. Because I see some people say, don't worry, just go into NHS, start from band 2, and when in 6 months you go to band 3. And now it's not. People that are in NHS are coming to us to do the functional skills and also do the level 3. Okay. And again, the beauty of this qualification is this: you can go into uni with this qualification, combining with your maths and English. Most universities will accept you to do so many courses. Go and just Google it. I'm not here to preach to you. This certificate, level 3 certificate diploma in adult care with your maths and English, just search how many courses, what courses can you use it to do in the uni. Okay, most universities will accept it. Okay, if you want to progress. What I'm doing, I'm just here to push people to upgrade themselves. You can't just remain in a minimum wage forever. Because I've seen people 10 years, 20 years, they are still in minimum wage. Okay, please do your certification. Do it anywhere you want. Okay, but let it not be CPD. It's not that we can offer CPD, but at the end of the day, you have all those CPD certificates that cannot get you to band 3. It's a waste of time.
Joke.
Yes.
I know someone that's advertising CPD certificate.
I saw it. I saw it.
For what?
Mr. Shooks, I forwarded that
and then
video
people
to
are getting
you.
and people are getting, unfortunately, but they don't know that CPD is not. You're doing CPD before you do the course itself.
Mr. Shooks, I forwarded that video to you now. The girl is
really?
People don't know what CPD is. So the people are sitting on TikTok and just passing wrong information. So you do CBT you do that one after you've done the course. So basically that certificate is just to say you have progressed yourself. You've done the level 3, maybe something to do with fire. So you know what fire extinguisher is used for what fire. So
it's just the surface of the whole thing. It's the surface. Just like what your company offers.
I did my CPD in 2 days and I got the certificate. I like.
Why would you do it in 2 days, Miss B? We'll sit down and do it under 30 minutes without pressing anything.
No. That's how people are marketing it for £1,000.
What do you say?
They don't know. They don't know. I'm telling you, they don't know.
Between £750 to £1,000.
Oh my days.
For the CPD certificate that's not going to take you anywhere.
They don't know a lot of things, a lot of wrong information they push out here. And those people are after, you see my problem with people, they are after your pockets. And when they bring that into my platform, I chase them away. Listen, I am not after anybody's money on this platform. Ask people, even from my old account, you know my motivation. I am a teacher by nature. And in my university, after I graduated and I wrote the professional exam, like I am a qualified teacher. So my joy is to see you understand what this healthcare assistant is all about. That you understand what the concept is all about. You understand what is expected of you. You understand the challenges involved. Some things you can come across, how you have to manage it, handle it, and all that. So you will be safe, and the residents will be safe because it is patient-centered. I will make you to understand these things, and I will put it to you as a question because what they ask them there is what we do. You get me, Miss B? I put it to you as if I will tell you this is what they are asking you, and this is what to answer, and that answer is what we do. We are not framing it, okay? And my joy is that you go for that interview, you build that confidence, you pass that job interview, you get the job, you go into the field, you do your job professionally. I wouldn't like tomorrow to come out and see, hey, this person that I prepared for, or this person that I know was involved in abusing a resident. I wouldn't like that. I want to see you professional, do your job, go home. Your manager can come up, can rely on you, your colleagues can rely on you, the resident can rely on you. That is my motivation. That's my reason for being here. Okay, so many of them, they go for that thing. When they pass, they come back to say, I passed though, they gave me sponsorship, please give me your account. Ask Chooks. If you mention account, I will tell you I am off. Do not give me. If you meet me on TikTok anywhere, you want to send me gift, I appreciate, but asking for my account number to send me money because you benefited from what I was saying as a result of my knowledge, experience, and skill, I am not in for that. But a lot of people on this app are telling people to pay the money.
Listen,
Pay
they're
the
paying
money.
extortionate. They're
Pay
paying
the money.
extortionate
And
money
if
for
you see
rubbish.
somebody who is money conscious, run away from that person. They are not after your they are not after your well-being. No, they are after your pocket.
Okay, now listen to this. Okay, I'll say someone telling people to do CPD certificates. Okay, then this same person, you claim you work with NHS, but you got into NHS. Everybody got into NHS through different routes. This person, you got into NHS, you did your masters.
Oh.
You see, sometimes people are just what better word should I use here? You understand what I mean? You are telling these people they've not done their masters in health and social care. You had a master on this, and you are telling these people to do CPD. Are you going to compare yourself with them?
You can't.
It's depressing, and these people asking for us. I see. It's depressing. It's very depressing.
It's very simple. Like I remember last year, somebody always come up here to challenge me whenever Jen was doing with her old account. Remember Jen, that lady? Okay, she was like CPD. I said, listen, I'm not laying down on your CPD. If that's what you have and it's working for you, good and fine. Okay.
It's not working, no.
wait. So I said to her, you cannot compare a certificate you got in within 30 minutes and paid £10 to print out a certificate. Compare with a certificate someone spent 1 year, 2 years in school, college. It's never the same thing.
You know what the problem is? You know what the biggest problem is? The problem is when you lack information, you think you have somebody else that knows what you're looking for, and they also feel like because you don't know, I'm going to take advantage.
Yes. Exactly.
Now, somebody sent me a message. I can screenshot it and send it to you. Somebody sent me a message and said to me, if I can identify a fake certificate. From your interview, I can. From your interview, I can tell you what you know and what you don't know.
Okay.
It's very easy. I don't need to look at that certificate and start looking if it has a watermark, if it has a this, if it has a that. I don't need all of that because now you can buy all of that online. All I need to do is have a conversation with you, and I can tell you very easy. But people need to stop extorting people. It's not worth it.
Ms. B.
I keep saying to people, the information that I give out, I am giving it away because it's occupying a lot of space in my head that I don't need. That's why I need it out. I need to put more new information in my head. I don't need to benefit in any way.
Exactly.
It doesn't add anything to me. Me giving you information that I have. It doesn't.
They monetize everything. They monetize everything.
Jenna, someone registered yesterday. Okay? Someone registered yesterday. Do you know, she said wrong information on TikTok. Okay? Stopped her from doing the training for almost a year plus. Now they told her, do your CPD, okay, you get a job with it. And she's been looking, unfortunate. Do you know what they told her? That she had to wait for 3 years before she qualifies to do a diploma level 3.
Was it not on this app that somebody said she was advised to go and do level 4? Barely 1 year you entered the UK, you've gone to do level 4 in how?
What are you talking about? Level 4?
She got level 4.
Wait. There's somebody who is doing healthcare management. Management. It pains me when I see people are like, hey, go and do the management course. Go and do. You will get a job. My first with them is, I have my company and I'm too busy to run my company, and I want you to come and run my company. What experience do you have? I'm not talking about the day-to-day. I'm talking about if CQ
is about to visit, what should be in place? What are they coming to assess?
Yes, if CQC turn up because of allegation of abuse, what are you going to do? How did you escalate the issue? How did you address
what documentation do you have?
If social services turn up and okay, how do you get rid of the medication in the home? What is the escalation procedure? When medication comes in, who does the medication audit? Who are you going to allocate what tasks to who? I keep asking big, simple questions like that, and people do not want PhD holders. They want hands-on experience. I have said that like 1,000,001 times. Nobody cares about your PhD. Nobody
cares. Your experience.
You can have your PhD as long as you have hands-on experience. That's why nurses are very quick to get jobs, because their course is hands-on.
Miss B.
This lady, what is want to ask a question? Please let her ask.
Oh yeah, ask now, because I'm rounding off. I will have to go pick my son in school.
Okay, ma'am. Thank you very much. I really want you to assist me, because anytime from now, I'll be going for my interview to study HND. And I'm going to ask a question where to express myself. And I really want you to tell me what are the exact questions or other things the interviewer is expecting me to say, please. Because this is my first time of trying this, please.
You are in the UK?
I'm Sierra Leone, ma'am.
And you are going for what?
Medical lab, HND.
I am a healthcare assistant. We've got what is called professional boundaries. It is not my field. So I'm sorry I'm unable to help.
Okay.
It's not my field, yeah. I'm sorry about
that. What interview are you going for?
Medical lab, ma. HND.
As a job or as at the school?
A college.
Where is the college?